Most think radiation is something you only worry about near nuclear power plants or after an X-ray, but the truth is far more disturbing. What if your daily exposure could quietly damage your organs, alter your DNA, and even affect your future children? Let's uncover the truth. Welcome to Levitas. Dangerous radiation levels. Radiation surrounds us, from sunlight to microwaves to medical imaging, but not all exposure is safe. The danger lies in the dose, duration, and type. Ionizing radiation, like gamma rays and X-rays, can penetrate deep into tissues and break molecular bonds, damaging your DNA. Levels above 100 millisieverts in a short time are linked to cell damage and increased cancer risk. Acute radiation syndrome begins around 1000 millisieverts. Even chronic low-level exposure from contaminated environments, medical treatments, or frequent flying can have long-term effects. Understanding the threshold of dangerous exposure is the first step toward protecting your health and longevity. These deadly effects can affect all aspects of life, and number 8 totally scares a lot of people. 1. Birth defects. One of the most tragic effects of radiation exposure is the potential to cause birth defects. When pregnant women are exposed to high radiation levels, especially during the first trimester, the developing fetus is incredibly vulnerable. That's because fetal cells divide rapidly, making them more prone to DNA mutations and cellular disruption. Exposure during this critical window can lead to microcephaly, a small brain, intellectual disabilities, growth delays, or even spontaneous miscarriage. The Chernobyl disaster tragically demonstrated this reality. Studies reported an increase in neural tube defects, cleft palates, and congenital heart problems in children born to mothers exposed during or shortly after the event. Even low doses of radiation, like frequent abdominal X-rays or radiation therapy near the pelvic region, can pose risks if not carefully managed. But the danger doesn't end at birth. Some research suggests that radiation-induced mutations can be inherited, affecting future generations. This makes radiation safety not just about personal protection but also about reproductive responsibility. Protecting your DNA integrity during pregnancy is critical, and exposure should always be minimized through protective shielding and careful medical supervision. 2. Cancer risk. Among all the known dangers, radiation-induced cancer remains the most well-documented and terrifying. Radiation can directly damage your DNA, causing mutations that, over time, may lead to uncontrolled cell growth, the hallmark of cancer. The most commonly linked types include leukemia, thyroid cancer, breast cancer, and lung cancer. Long-term studies of atomic bomb survivors in Hiroshima and Nagasaki revealed significantly higher incidences of cancer, especially in individuals exposed as children. These cases helped establish the linear no-threshold model, meaning no amount of ionizing radiation is entirely risk-free. Even diagnostic imaging, such as frequent CT scans, can slightly elevate lifetime cancer risk if overused, particularly in children. Radiation therapy for cancer treatment, while life-saving, also carries a risk of secondary malignancies years later, especially when high doses are applied near sensitive tissues. Radiation causes double-stranded DNA breaks, which are difficult to repair. Over time, these breaks can accumulate, disrupting tumor-suppressing genes and enabling the development of cancerous cells. Understanding your radiation exposure history and minimizing unnecessary exposure is a powerful way to reduce your cancer risk and safeguard your long-term health. 3. Organ damage. Radiation doesn't just affect isolated cells, it can damage entire organs, especially when exposure is concentrated or prolonged. Organs with rapidly dividing cells, like the intestines, bone marrow, and lungs, are most vulnerable. In acute radiation syndrome, which occurs with high-dose exposure, the gastrointestinal system may be the first to suffer. Symptoms include bleeding, diarrhea, and intestinal lining erosion. The heart and kidneys can also be harmed. High doses of radiation near the chest, as seen in cancer patients receiving thoracic radiotherapy, can cause pericarditis, the inflammation of the heart lining, fibrosis, and long-term cardiac dysfunction. Similarly, the kidneys may experience radiation nephropathy, which leads to hypertension and renal failure. One of the most critical areas is the bone marrow, which produces red and white blood cells. Radiation can destroy this function, leading to anemia, immune suppression, and increased infection risk. The thyroid gland, particularly in children, is also extremely sensitive and susceptible to developing nodules or cancer after exposure. Organ damage may develop gradually, often years after exposure, which makes early detection and long-term monitoring essential in individuals with a history of medical or environmental radiation exposure. 4. Skin burn. Radiation burns occur when high doses of radiation hit the skin, leading to cell death, inflammation, and tissue breakdown. Unlike thermal burns, radiation burns develop slowly, often days or even weeks after exposure. The skin may become red, blistered, or ulcerated, with prolonged healing times. Cancer patients undergoing radiation therapy often experience this in treated areas, resulting in pain and increased infection risk. High-dose accidents, like in industrial or military settings, can cause deep tissue necrosis. Protective barriers and proper handling protocols are essential in preventing this painful and sometimes disfiguring form of radiation damage. 5. Hair loss. Hair loss, or radiation-induced alopecia, happens when high doses of radiation target the scalp or whole body, damaging hair follicles. Radiation disrupts the follicular cell cycle, halting growth and triggering sudden shedding. This is common during cranial radiotherapy, and the loss may be temporary or permanent depending on the dose and duration. Unlike chemotherapy-induced hair loss, radiation-related alopecia is usually localized and more intense. In some cases, scarring can prevent regrowth altogether. Protecting the scalp during imaging or therapy and using low-dose, targeted techniques can minimize this distressing side effect for patients already navigating health challenges. 6. Nausea and vomiting. Nausea and vomiting are classic symptoms of acute radiation exposure, particularly at doses above 1000 millisieverts. Radiation disrupts the cells lining the stomach and intestines, triggering an immediate stress response from the brain's vomiting center. This can begin within hours of exposure and worsen over time. Cancer patients receiving radiotherapy near the abdomen or head often experience these symptoms, which severely affect appetite, hydration, and quality of life. Antiemetic medications can help, but prevention starts with limiting unnecessary exposure and ensuring treatments are as precise and localized as possible. 7. Fatigue. Radiation-induced fatigue is one of the most common and debilitating side effects reported by patients undergoing radiotherapy or exposed to environmental radiation. It stems from inflammatory cytokine release, oxidative stress, and the energy drain of repairing cellular damage. Even low-dose, chronic exposure can lead to persistent exhaustion, mental fog, and reduced stamina. Unlike ordinary tiredness, this fatigue doesn't improve with rest and can linger for weeks or months. Supporting mitochondrial health, maintaining nutrition, and managing inflammation are crucial for recovery. Recognizing radiation as a fatigue source helps guide better care and lifestyle strategies to restore energy balance. 8. Fertility issues. Radiation exposure can impair both male and female fertility by damaging reproductive organs and altering germ cell DNA. In men, radiation may reduce sperm count, motility, and lead to testicular atrophy. In women, it can disrupt ovarian function, trigger early menopause, and reduce egg quality. These effects depend on dose, age, and exposure site, but even moderate levels can have lasting impacts. Radiation used in cancer therapy often requires fertility preservation strategies like egg or sperm freezing. Protecting reproductive organs with shielding during imaging or treatment is essential for preserving future fertility and hormonal balance. 9. Cataracts. Radiation cataracts develop when ionizing radiation damages the lens proteins in your eyes, causing them to clump and cloud your vision. The lens is particularly sensitive, and even moderate exposure can accelerate oxidative stress, leading to opacity and vision loss. Pilots, astronauts, and radiology technicians, who are exposed to cosmic radiation or repeated medical exposure, are at elevated risk. Cataracts caused by radiation may form earlier than age-related ones and often progress faster, Protective eyewear, radiation shields, and minimizing head exposure are essential for prevention. Regular eye exams can catch early lens damage and help preserve long-term ocular health. In conclusion, radiation exposure poses far more health risks than most people realize. From DNA damage and birth defects to deadly cancers, organ failure, and even infertility, radiation disrupts every system it touches. The cumulative effect of chronic or high-dose exposure can result in inflammation, fatigue, and dangerous cellular mutations. Even moderate exposure can trigger skin burns, hair loss, and vision loss through radiation-induced cataracts. Understanding the biological impact of radiation on your hormones, reproduction, and long-term health is crucial. Protecting yourself from unnecessary radiation is one of the most powerful ways to support your longevity, metabolism, and overall well-being. Thank you for tuning in to Levitas. Please share today's video with friends and family, comment, give it a thumbs up, subscribe, and hit the bell icon to receive notifications for future videos. Your support is appreciated. It helps us grow and create more content to empower your health. Remain tuned to Levitas for more expert advice on your health and fitness journey. So, stay healthy, stay happy, and keep going.